Hello, everyone. My name is Diana Tran, and I'll be presenting Health Education Intervention Project in CHOC Clinic. So the two health-related problems I focused on was diabetes and obesity and nutrition. With diabetes, the reason for the teachings are because there's a high risk factor from obesity, there's lack of healthy eating, and lack of exercise. For obesity, there's high obesity rates, physical exams showed needs of lifestyle changes, and there was also a language barrier, Spanish. So the background and significance, CHOC Clinic serves a pediatric population of insured, uninsured, disadvantaged, and have low socioeconomic statuses. Most of the children seen at the clinic were obese. Obese adolescents have a 70% chance of becoming obese adults. Santa Ana BMI rate is 46.5%, which is very significant. Excess weight gain during childhood and adolescence can go into adulthood and increases risk for diabetes, sleep apnea, cardiovascular disease, and hypertension. Also, soda, fast food were being consumed at least 3 to 4 times a week. There's also a lack of physical activity. Children were mostly watching TV and playing video games, as identified during physical exams. Also, neighborhoods were unsafe for outdoor activities. So Healthy People 2020 objectives for diabetes was to reduce annual number of new cases of diagnosed diabetes in the population, reduce death rate among people with diabetes, improve glycemic control, reduce rate of lower extremity amputations in persons with diagnosed diabetes, and to increase prevention behaviors in persons with high risk for diabetes. Healthy People 2020 objectives for obesity and nutrition were to increase number of states with nutrition standards for foods and beverages provided to preschool-age children in childcare, increase the proportion of schools that offered nutritious foods and beverages outside of school meals, increase number of states that incentivize food retail outlets to provide foods that are encouraged by the dietary guidelines. And lastly, to increase the proportion of Americans who have access to food retail outlet that sells a variety of foods that are encouraged by the dietary guidelines. Needs assessment. Most of the patients seen at CHOC Clinic had chronic conditions such as obesity and diabetes. When we interviewed the parents, there was difficulty adhering to multiple appointment dates because of lack of transportation. So it's very hard for these parents to follow up with their child's health, since it was very difficult for them to get to the clinic, especially when they had multiple appointment dates to follow. There was also a language barrier seen, and that's Spanish. It prevented the parents from asking questions to better understand their child's needs. There was also a lack of education on nutrition. And on the physical exams, many patients were obese. So theoretical framework proceed model. The model guided the project by setting goals and priorities on what to target in the population, and it helps to achieve the desired outcome of the intervention. Also, there was guided implementation that helped to design and create the intervention. It also allowed for evaluation of intervention and outcome evaluation to assess if the intervention actually worked. The model determined what was needed to be done and how to do it by assessing behaviors and needs of the population, and that helped to formulate ways to target those behaviors and needs. Also, it helped with the understanding and analyzing the community and the issues they were facing, so it helped to develop interventions that would address those issues. The issues and barriers that were encountered during the project were that parents were mostly Spanish speaking, resources such as projectors were not available, parents were pressed for time due to other obligations like childcare and what to do at home. Not much space was provided in the classroom. Some assets of the project were that parents were very involved in the activities. Parents and children asked many questions, and parents gave feedback stating they enjoyed the class very much. So the first intervention was obesity and nutrition. I used handouts, nutrition labels to demonstrate how to read them. Also, real food and snacks were provided to explain the nutrition label. Each person in the room had a different snack, and they explained what was on the nutrition label, and if there was any misunderstanding, that was corrected. So it just helped to know, to figure out what they were understanding about nutrition labels. Parents and children created menus for school, and I also discussed my plate health guidelines. In addition, I also discussed grocery shopping and how to budget grocery shopping for healthy foods. The Healthy People 2020 objectives that were partially met due to the fact that the interventions target a small population and not the states or the school population. The second intervention was diabetes. Handouts were given to the parents with signs and symptoms of diabetes, and it also explained the two types of diabetes, diabetes type 1 and diabetes type 2. I also showed a poster of the mechanism of diabetes in the child's body so they could better understand how diabetes works. I also tied in nutrition to stress the importance of nutrition as being a factor of diabetes. So the Healthy 2020 guidelines that were met were to increase prevention behaviors in persons with high risk for diabetes and to improve glycemic control. So the budget was very minimal. Basically, there were just only handouts and snacks and food that were purchased, but it wasn't very expensive. The project was supported very well with a small budget. If the educational classes were provided every week at the clinic and they were free to attend, the population of diabetic and obesity rates may decrease significantly. And also visuals that were used were relatively cheap. Project evaluation and outcome of measurement. Evaluation-wise, the goals of the project were to educate the population on these two health-related issues, to decrease obesity, BMI rates, and diabetes rates at the CHOC clinic, and to spread awareness of two prevalent issues in the population. Also, the goal was to stress the importance of these two issues. The outcome was 65% of the class will state 3 healthy snacks for their menu. 65% of the class will state at least 3 reasons why it is important to eat healthy meals. And 50% of the class will state 2 causes for diabetes. 50% of the class will state 2 ways to prevent diabetes from occurring. And the long-term goals was to reduction in obesity rates, BMI rates, and diabetes rates. And all of those were achieved. At least 80% of the class met all of these outcomes. So overall, the education classes went very well. The weaknesses in the project was I felt that the diabetes class wasn't as interactive as the nutrition class as I would have liked. Probably next time we'll use more interactive activities. Also, the difficulties was waiting for the approval of the site for scheduling a time to do these classes. Organizing dates for the education at the site was very, very difficult. Also, language barrier made teaching very difficult. Possibly we'll use an interpreter next time. And these are my references, and that includes my presentation. Thank you all for watching.